Hello and welcome to an episode of the Hinted Neuron podcast. As always, I'm your host Kelvin, and it's so nice to finally be doing an episode again after such a long time. This is my first episode of the year, and I spoke with Dr. Kristen Yeasted. Dr. Kristen is the chair of ethics at the St. Elizabeth Hospital. We spoke about AI and humanity and healthcare and how all that fits together, especially how healthcare workers would interface with AI technologies and how patients and people in general will start interfacing with it, and the ethics of that and what's to be considered and how we should move forward. Dr. Kristen is a medical doctor and is also the author of the book The Final Invention, and where he talked about how we as a society or as people will begin to interface or interact with AI, and the kind of challenges that would bring and the type of things that we would begin to do and think about, or we should think about. So yeah, without further ado, I bring to you my conversation with Dr. Kristen Yeasted. I am here with Dr. Kristen Yeasted. Dr. Kristen, thanks for coming on the podcast. It's really a pleasure to have you.
Kelvin, thanks for having me. Pleasure to be here.
So you're a medical doctor. I would allow you to introduce yourself in a bit. So you're a medical doctor and you're also thinking about AI ethics. So you've been thinking about it for a long time, and you also have a book on this. And, it was a really pleasure reading your blog and seeing some of the things you've been thinking about.
Yes. So finished my training for medicine back in 2015, and then moved from University of Chicago over to where I currently am living in Youngstown, in Ohio. And after a couple of years of practicing medicine, I started to think, well, I think I've got a pretty decent handle on the most important parts of medicine. So while I continue studying, because that's what our ethical duty is as providers, I'm also wanting to expand the horizons a bit. And I always was interested in ethics. I was in the ethics committee in my residency program. And it just so happened that that there was an election for the next chair of ethics. And I was granted that title. I was very fortunate. And after just maybe a couple of years of doing bioethics, where we deal mostly with end-of-life issues, maternal morbidity, mortality, you name it, I wanted to expand beyond that. And I guess I've always also had an interest in artificial intelligence. Maybe I was influenced by the media, maybe working with playing with robots as a kid. It's hard to say where these things come from, but I certainly recognize that the development of artificial intelligence could potentially pose an existential threat. And I thought, this is the next frontier of learning and of ethics. And if there's ever a need for ethics to be applied, aside from at the hospital, this is it. So I started diving in, and I was researching. I researched for approximately 7 years before releasing the book. And then in the book, I summarized the research in an entertaining way, with a plot line and whatnot, to talk about how AI will influence many different parts of our lives: law, medicine, and the judicial system and law enforcement, finance, and even religion I get into. So I try to cover all the fields possible. And I think that through all the research, I've come to the position I am right now, where now I'm being asked to do discussions, inform other doctors about how AI is going to be used in healthcare. And yeah, that's my most recent story.
Yeah, thanks for that. Thanks for that really nice introduction. I think, I think for me, I only started thinking about AI ethics, I think since 2019, which is not very long ago, maybe 2019 or 2018. that was in my final year of university at the time. That was when I started to think about ethics in AI and law and social issues that AI might bring up. But I think one of the things you mentioned now really gave me some insight into some of the things I even haven't considered in like maybe medicine or like patient care or like patient information. And I think one of the really good starting points for this conversation would be talking about large language models and patient information because right now there's all these issues about how large language models, AI models are being trained, the data that goes into it, and what type of records are being used to train the data. So I guess because I know that right now, even private companies are like collecting large amounts of internal data to train some type of private AI models that they could use for their own systems. So I kind of wonder how, for in a case like healthcare where of course, it will be beneficial to have some type of AI systems, but what type of data is being used to train this type of systems right now? Yeah.
Right. So it's a very good point. I think now more people are aware of the potential biases in the AI systems. They may or may not be aware that that bias is fueled from the data that's collected. And even the best of models that have they might have maybe billions or trillions of parameters, just gathering data everywhere possible, but it may not be the best data. Sometimes it can be in medicine at least, a kind of a self-reinforcing pattern where if you only gathered data on, say, the sickest people, well, it doesn't. The algorithm doesn't care why are they the sickest. I mean, is it because of socioeconomic issues? And maybe you try to factor that in, but you might have right now the sickest population being also the most underprivileged populations. They might be the poorest. A lot of times these socioeconomic factors go together, and if you have the algorithm gathering data, it's going to interpret and spit out that data. The output is going to be biased in favor of or against the patient populations that are gathered. So it's difficult to avoid the bias. You try to be selective with your patient populations that you feed into your algorithm, but then you end up maybe getting less data, fewer numbers, and so that makes it harder for the LLMs to function properly. And even the best LLMs, they still are having 3% hallucinations and overall accuracy of 80%, maybe a little more, depending on how you work the numbers and what is asked of it. So these just are tools that are not perfectly reliable for sure. Maybe not even as reliable as doing actual research if you're trying to find an answer for a patient, find the best treatment, etc. Where we are with medicine now, I can at least speak to my healthcare system, where we are working with many different companies, all of them offering technological advances to our electronic medical records in one form or another, trying to give us technology, software that will enhance workflow, that will make everything run more smoothly for nursing staff, let's say. It will be diagnostic assistance for doctors trying to treat a patient. And I guess we also do have some, you might call it a chatbot, but it's basically the patient interaction, and it's meant to guide patients a certain way. Now, one of the questions that you have to ask is if you have an algorithm that is essentially a chatbot and it's interacting with patients to try and maybe offer services for your from your healthcare system. Say, okay, you've got, tell me more about what your problem is. Okay, well, here's what we can do to help. Well, that may or may not be an issue ethically, because a lot of times that's for marketing, and that is meant to make your healthcare system be of service to the patient. But in so doing, unless that algorithm is also referring the patient to some competitors in the area, then that marketing tool is leading the patient down a certain path, and the patient won't know that they're looking at an ad. They'll be essentially fooled into thinking that they might know it's a machine, but they won't realize that they're being funneled to a certain healthcare system and at the exclusion of others.
Yeah, you make some pretty interesting points, and I think this is, I guess I had a couple of thoughts, but I think one very interesting one was the way patients interact right now with these systems and the way doctors like use certain AI assistants right now. But do you think that, because I know the way the US healthcare system is organized, you usually have some type of medical assistant and that type of job where people, maybe like a nursing assistant or a medical assistant. Do you think that AI is basically more or less like a replacement for those type of jobs, or I don't know?
So one of the things that Musk has discovered is sometimes there's no replacement for the human body. And if you're trying to be as efficient as possible, it just helps sometimes to have a person who calls for the patient, brings them back, sets them up in a room, puts the EKG leads on them, there to draw blood. It's tough to replace the human hands as tools. So, and I think, but that's all the technical side of things. What's most important, and what I do talk about in my book, The Final Invention, because that's, AI is the last invention we'll ever need, right? Is there is no replacing the human compassion element. So we could start with healthcare and go from there. But regardless of how good the technology gets, unless we create whatever medical bot as if we can't create it with emotion, then it will never have true compassion for the patients that it serves. And that's the foundation of healthcare, is caring about your patient population. So I don't think it's possible to fully replace the medical assistants, nurses, or doctors, for sure. Will a sophisticated enough machine be able to fill in some of the tasks? Possibly. They already have automated blood drawing machines, and then we already make use of chest compression machines. Of course, a lot of times you find out that these tools are not as great as you originally thought. I think medicine has a history of, decently vetting some technology, saying, okay, this is past safety standards. Okay, maybe it's even going to be useful. But then they put it into practice, and over the years, it just kind of dies away because, hey, a human can do some chest compressions pretty easily too. And maybe it's just too cumbersome to carry this machine around that you have to put over the patient position, right? He's got to get right up on him, So practicality kind of overtakes the theory sometimes. I think if you were to have a machine trying to do the job of an MA or nurse, it would definitely be cumbersome in the beginning, especially because all the clinics are already set up for humans. I mean, the counters are a certain height, and all the equipment that you have to reach is up in the cabinets sometimes. I mean, it's just, now will we be assisting machines in some way physically? Maybe we already are. But as far as a physical machine, probably it's not going to be too viable to replace the staff. As far as clinical decision making for MAs, nurses, doctors. So this is more software now. It's there are some things that will certainly be augmented with the electronic health records starting to use more AI, Gen AI, generative artificial intelligence, and maybe some clinical support is going to happen. Your doctor's trying to think creatively about a diagnosis, but you can only think of 19, and then the AI comes and gives you the 20th one, and you're like, okay, I guess I didn't think about that. That's one way that we'll have augmented intelligence, is what the American Medical Association likes to call it. They don't want to call it artificial intelligence, augmented intelligence. Okay. And I guess other ways are just certainly better workflow. So less cumbersome note taking by the doctor, so that the doctor can actually do what the doctor is supposed to do, make eye contact with the patient, really care about them, and not be caught up with just all the computer busy work they have to do. So that's being implemented right now as well. Just kind of, there's a program that is going to listen to the entire conversation with the doctor and patient, and then basically summarize it in a note format that we would normally use. And then the doctor is supposed to look over that note, verify that it's okay, and go with it. Couple of caveats to that. One is, we'll work backwards. If you have a machine that's good enough and an algorithm that works well enough almost every time, there's a concern that the medical providers might get a little lazy and not review the notes as thoroughly as they should. Now, the flip side of that is, hey, if the technology is actually working the way it's supposed to, and it really does summarize everything perfectly, eventually, over the months, years, it would be foolish of the doctor to review it, because the tool works so well. And then, I guess other things about the clinical decision making support tool. If the machine throws in that 20th diagnosis, well, maybe it's going to be the correct diagnosis, but probably it's not, because, as we say, common things being common, the patients usually have pretty similar problems to each other, just on the bell curve. And you're usually not going to need that 20th diagnosis. So,
So, I mean, in a case where maybe a doctor maybe uses an AI tool to fully generate some type of diagnosis for a patient, or maybe a patient is interacting directly with an AI tool, and they have some type of diagnosis, and then the patient goes through, buys some type of medications, they get sick, or their situation gets worse. I guess in that case, who bears responsibility in the case where maybe a patient is directly interfacing with maybe some type of AI tool that is branded as some type of medical solution? So is it the creators of the tool, or maybe, because I don't know how this kind of system would work if a doctor is supposed to fact check some type of diagnosis that an AI tool spits out. But I guess, who bears responsibility in like the broader sense of a patient interfacing or a doctor interfacing with AI tools?
That's a really good question. And that is the question, right? When it comes to liability, I think some doctors are wondering that themselves, just who gets sued here. But
Yeah.
So we can take an example of how it is right now. Patients are already going online, and maybe they always have gone somewhere else to find a diagnosis. Old wives' tales about what health benefits there are to do, something with onions and lemons. I don't know, and then they run a risk to their own health if they do something that ends up being detrimental, whether the doctor said it was a good idea or not. So, maybe that's it's always been an issue. Now there is information on the internet that sounds very formalized and seems to be, and depending on which website you go to, might even be backed by some research. And the patient will often go there instead of, sometimes they'll do both. Of course, they'll try to come to their care provider as well. But hey, it's a lot of patients will research, and they will act on that research they get. Sometimes it's just the word of mouth of a friend, but they'll go to a place like GNC or some place where they get over-the-counter medicines, and they don't fully read about potential side effects. And then before you know it, you might have a patient who's on 20 different vitamins at once. I've actually seen that. And they won't even be able to tell you why they're on all of them. So it can get very messy very quickly. And if you have a situation like that, a lot of times the companies that produce the vitamins, or if they give advice online, whatever, they'll always have that caveat that says, not to be used in place of your medical provider's input. Make sure you go see your doctor. And so now, if I think the way it is right now, it's an evolving process for sure, but the medical legal state is now, the software company, there's basically three major players. There's the software company, the hospital or health system, what have you, and we'll say doctor, the care provider. The software company will create the product, and often they will have that caveat in there that, hey, this is not meant to be used in place of seeing your doctor. And I guess now's a good time to say that the caveat for OpenAI in their terms of use says, do not use this for medical, legal. They list all the different fields and says, don't use it for this. Don't use ChatGPT for this. Well, people still do. And then you have the hospital. They're supposed to vet these software companies, figure out which ones are reliable, making a product that is, NDP, then beta tested, and then tested in maybe some larger health centers. And then eventually, this health system, they say, okay, well, this is a good enough product. It's made by Microsoft, it's made by IBM, we're good. And then if something goes wrong, the hospital might bear some responsibility there too. Then there's but a lot of times the hospital, they can kind of protect themselves against legal action a lot. The software company has their protection. They have their caveats encoded in the terms of use. The doctors, the care providers, a lot of times don't have any real recourse to protect themselves against lawsuits. A lot of times the doctors, the care providers are just using whatever the hospital health system says to use. And if it's incorporated into your electronic medical record, you really don't have a choice there. But if there is a clinical decision support tool that leads you astray and makes you use the wrong diagnosis as a doctor, it really comes down to, okay, well, how good is this system actually? And if it's really good, really reliable, really accurate, then you would have been wrong to not use it.
Yeah. And I think, something that I just thought about now, if you even remove AI, I think maybe there's also a place for ethics on the patient's part, because something that I thought about was, a case where a patient might read up something on the blog online and they see some type of, medication that they could take, and then they eventually take it, which was not diagnosed by a doctor. So they take it, imagine they have an official diagnosis by a doctor, and then they take this medication that they read online. Something happens to them. So Now, it could be that this wrong thing they saw online actually caused their problem, but because that information wasn't given to the doctor, then the doctor would have to bear responsibility that the official diagnosis that he gave was what caused the problem. And maybe if the patient is not willing to disclose the information that he actually took some other type of medication that wasn't the real thing. But I guess there's much protection against that, since I would say most people can get some type of drugs without prescriptions these days, right?
Yeah. Oh, yes, definitely. But so to your point, a duty of care would have to be established, and a lot of times that means that there has to be proximity, and foreseeable, a foreseeable part. So what that means is, from a legal aspect, basically, if a patient goes and does something on their own without the doctor's knowledge, it's probably not going to fall ethically on the doctor. Now, if they do it based on a misdiagnosis, possibly. But I guess if a doctor diagnoses someone with, if you name it, a broken leg, and then the patient reads somewhere that, I don't know, taking medicine XYZ over the counter is really good for a broken leg. If they do that without discussing with their doctor, without following that company's caveat on their labeling, I mean, that's usually not something that you can pin onto the doctor, because cause has to also be part of the case against the defendant here. So you need to be able to show that what the care provider did, the action that the care provider took, caused the negative outcome. And I think if a patient does something on their own without discussion with the doctor, that's usually not something that you could say was caused by the doctor, hospital. That would be more like a company thing if a lot of people are getting sick off of medicine XYZ. And then a lot of times the FDA, if they're regulating anything, they'll pull it from the shelves, they'll do a recall, etc. So that's more the company side. But if you have the care provider that has a duty to care, so there has to be proximity. It has to be like a doctor-patient interaction with nothing in between. And foreseeableness means, and this is the tricky part, that the doctor had to foresee that the action they took might, and perhaps would, result in a negative outcome. The problem is, if you are using an algorithm as an intermediary, two things. One, it's not always, it's going to be very difficult for the doctor to actually foresee if using this algorithm will result in a negative outcome for the patient. A flip side to that is, well, the software companies that make these algorithms, clinical decision support tools, whatever, they know down to the percentage about how accurate it is. Like they should be able to foresee, the company should be able to foresee what percentage of negative outcomes might be expected. The doctor's not always going to know that. And again, you try to use tools that you understand, but if you're handed a tool and told that it works and, it should be safe, go ahead and use it. A lot of times we do. And that's kind of where the principle of double effect comes in. Your intention is good, and your action is at least good, or at least neutral. And the expected good outcome outweighs the expected bad outcome. So you got a tool that works 80% of the time, you might be okay using it if you're trying to help the patient. It's that 20% that's the tricky part. So you'd have, and then there would be some that might argue that, hey, listen, if you've got an AI tool that is being used by the doctor for the patient, and this tool is, spitting out lots of information that's not always interpretable by doctor patient. If it's making if it's thinking on its own a little bit with machine learning, maybe leading you as a doctor down a path. Now you've got another party involved. This is just an argument some people make. And then the proximity is questionable, because I'm the doctor, you're the patient. But if we've got this AI that's in full force working between us, I mean, what's the proximity to doctor patient? It gets a little blurred.
Yes, it seems like that's like an unsolved problem because now it's like a party of three, and but I guess just in similar to that, what do you think is like? I guess because I know that's one big issue right now about ethics. I guess I don't know, since it's obvious that people have already started thinking about it, but what do you think are some other immediate ethical concerns right now as regards maybe the use of AI, or I guess even the use of technology as a whole, I would say?
So, are we talking medicine in particular? If so, we can start there.
Yeah, maybe healthcare. Yeah.
So the biggest ethical concerns in healthcare, with healthcare using AI at this time, would probably be the potential danger, because these tools are not as finely tuned as we might think. And it is unethical to use a tool that doesn't work very well. Another ethical problem would be that it might cause some dissociation between the doctor-patient relationship, which has been getting gradually worse with technology as a whole, to the point where doctors are mostly spending a lot of time just staring at the computer instead of talking with their patient. Right. It's like a little micro America in there. And then another ethical concern, you could argue that there will be some job displacement. It seems like there are two camps now of people who feel that AI will take the jobs, and those who are not, who don't show that concern. I am not concerned about the job market in the long run. Technology has so far done nothing but create new jobs that never would have existed before. And a lot of people, counter argument to that would say, well, but AI is different. And I don't see that it is. I still look at it as a tool, which I think everybody should. And it's just it's a tool that's being created quickly and changed fast. But if we keep up with it and we work with it, I guess an ethical concern, ethical versus societal, would be that the AI starts to run things, in the sense that the algorithm starts to make the decisions, and the doctor becomes lazier and lazier with his thought process, and the machine, and relies more and more on the machine. That would be a conflict there, because the doctor is supposed to do the caring, that can be the compassionate one, and use means to make the patient better. And part of that caring is supposed to be truly trying to diagnose in order to treat appropriately. And if all of the work is taken out of the patient care thought process for the doctor, well, then what's the doctor? He's just kind of sitting there not doing much, just letting the AI tell him what to do. And then we're out of the loop. And I think it's at this point too great a risk, maybe just because the technology hasn't evolved there yet. But it just seems that the healthcare providers they got into that profession because they care, and that is one thing that machines will never do, is care.
Yeah, I want to talk about compassion, but before I go there, I think one immediate thing I want to ask is how you think, because I know you also teach, like, how do you think maybe doctors of tomorrow, what changes in how they're trained now, in sense of, like, certain skills may or may not be necessary anymore, maybe because of improved technology, AI tools and all, but I guess what do you think changes in how we train doctors or healthcare practitioners in general, I guess?
Also a good question. Certainly I'm not a futurist, but based on the trends in AI and also in what we learn in medical school and residency, I think I will say that, first of all, it seems the workload is getting a little easier to bear. You know, they used to call the doctors in training residents because they would reside in the hospital. 120-hour work weeks, crazy stuff. But now you can do call from home using the technology. And then you don't have to carry your pager around as much. These are a little more the technical side of things. But I guess we have access now. All doctors do have access to the most up-to-date medical literature. They just go onto the up-to-date website. If they're not entirely sure how to diagnose something and how to treat it. And when I say not entirely sure, it's because, I mean, medicine's such an evolving field. There's all these new lab tests that are coming out that you want to make sure you're on the bleeding edge of medicine and you're doing things right. So you don't want to miss a lab ordering. And then there's all kinds of new treatments. Pharma has its ups and downs, but at least America is a place where new medicines are getting pumped out. You know, lots of research being put in. They're getting pumped out a lot. So you got to keep up with which medicines are most recent. The material you're trained on in medical school and residency is certainly going to be different from it was maybe 60 years ago. I mean, we just know more details now, but you also have to learn to use the tools at your disposal. I think two things with that. One is we will become more and more adept at using those tools, using the computers, making use of your specialists around, because now there's specialists and subspecialists all over the place. So I'm a primary care physician. I think there's some primary care docs out there that could make a career out of doing nothing but referring to other doctors, knowing where to go. We don't teach that, and for good reason. You don't want to die before you're dead. You don't want to lose all of your skills, unless you have no choice. But there's, I guess, there is some more reliance already on technology. I'll just say it. I mean, so I mentioned the website you go to. Well, now you don't have to memorize every treatment for every condition, and maybe they used to in the old days. You don't have to read the whole book of Harrison's front to back several times over just to be a competent doctor. You have to be compassionate, and you have to be clear thinking. They have what's called systems-based practice, and they have all these metrics that the attendings will review to make sure the resident in training is meeting these milestones. So, and they're not just, hey, how's your medical knowledge? That's only one part of it. Now it's, hey, do you know how to make use of the society around you? What resources are available to you? What tools do you use? Are you competent doing procedures? So it's, and of course the procedures, they change a little bit too. You have all kinds of new guidelines, regulations on how to do it. So it's getting more detailed, the practice of medicine, but our brains can only accommodate so much. So we really rely on the technological aid, the information online. I mean, you barely see any books anymore in the offices because why bother?
Yeah, definitely.
So if we develop more sophisticated and more user-friendly tools, AI, Gen AI, what have you, that make the whole process of medical care even easier, I think doctors will be they'll know how to use that tool, but I feel like they might also become more reliant on that tool. And there's always going to be a bell curve of competence in every profession. The most competent ones, I would say, the most competent doctors are really, really adept at using the AI technology to benefit the patients. It's going to be a partnership, but I guess one last point I'll make, and this is probably the most important one. At this time, the doctors who are advocating for AI development and incorporation into the health systems, they are very sure to say that the doctors should be guiding the use of these AI tools, that the doctors should be guiding patient care. Governance is what the word they use. And it's essentially meaning staying in the loop. But more to the point, it is making sure that the doctor, the human, maintains control of the patient interaction and the tools that are used to help the patient.
Yeah. So, I mean, really good. Now I think, I get that, because it seems as though certain people sometimes are opposed to certain things, or they want to maintain certain ways. Yeah, so like I was saying, I saw an old newspaper article where mathematics teachers were protesting against the use of calculators. So maybe at the time calculators in school were a new tool, where they thought that, students will no longer be competent if they have to use calculators in class or something. So I guess there's always that pushback from some people when there's some type of new technological advancement, because they don't know how to accept it, or they don't know how to, or I guess they fear how things will change in the introduction of this technology in some ways.
It's a fair point. Comparable, but I feel like calculators are pretty good tools and pretty accurate and pretty reliable. Whereas students now are using ChatGPT to write their papers, and it's not even the biggest ethical concern when it comes to AI in education. But I spoke with a high school student recently who just didn't see any problem at all using ChatGPT for the paper, and but then the teacher was making them write a list of pros and cons about using it. I mean, essentially making them write a paper that's a debate, and you have to take a side: yes to ChatGPT to write papers in school, or no. And this person was very much in favor of doing it. And when I asked why, it said, because I don't want to do it. It saves me time. And yeah. So, but ChatGPT is not nearly as precise of a tool as a calculator.
Yeah. I guess one of the ways I've always thought about this is, I guess good writing is basically maybe good thinking, and maybe knowing how to write is having a train of thought and thinking through something and laying it down. So I guess the primary skill for writing would be knowing how to think. And I think in some ways, I think it bothers me that, if you take any field like medicine or law or science or anything, if you don't know how to write, it means you're denying yourself the ability to develop clear thinking in some ways. Do you think, I don't know, I guess I don't even know the question, but it's just more, do you think there might be a problem with clear thinking now that, because as you said, at the high school level, if someone who already has a professional career uses ChatGPT to create a report, I guess to me, I wouldn't bother. They pass through certain levels of education. They did a lot of writing and reading in their time. They know how to think. That's why they're where they are. But at the high school level, that's where you're developing critical thinking skills, reading skills, writing skills. So I guess, I don't know, would it not really bother me to start using those type of tools at that level?
Yeah, that's it's definitely a concern. And I think that concern is shared by a lot of teachers, that critical thinking is starting to suffer. Now, I wish I could go back in time and find out if teachers in the old days thought their students could think critically or not. I feel like might have always been a complaint. But I just don't think there's any question that when you develop a tool, you lose something that you had before as a human being. And it's not to say that it's something worth keeping. But, I mean, when I guess when we developed a buzz saw, then we didn't have to do the sawing manually anymore. We probably lost a little bit of arm strength, but then again, we found plenty of ways to compensate for that. Now that's more of a physical rather than mental aspect, but kind of interrelated. Nowadays, if we want arm strength, we go to the gym and we lift. Nowadays, if we lose our ability to memorize things, like in the old days, doing it by rote. Now maybe we instead just spend day after day, all day researching things online that we find fascinating, and we're much more likely to remember things that we want to remember. Yeah. And that might actually potentially lead to more productivity, and not to get too broad too fast, but I think a lot of economists feel that productivity is the absolute key to creating a healthy society. Well, I don't want to use that healthy term too broadly, but if you are going to be able to take care of your own country, feed and shelter and provide protection, et cetera, have a good GDP, you need productivity. And that's one of the reasons why AI is so sought after, general AI especially. But yeah, so general artificial intelligence is desired for just that thing, because it's probably going to increase productivity. At least that's what the expectation is. So if you can have more productivity, you're supposed to have a more, I guess your nation should be a little better cared for. You'll have enough finances to do what you need to do, et cetera. So the productivity is going to probably increase as we get more and more entrepreneurs that are diversifying their knowledge by researching what they're interested in, what they're passionate about. You might get an even more industrious workforce. So there could be some potential upsides to a change in the way that we educate our kids. But until the tools that we're giving our kids are more reliable, it's probably more unethical to use them. So large language models, and that's the thing, what are you using them for? So the student that I mentioned was saying that it helps you also think creatively, helps with your creative writing. Fine. If you wanted to, you give it a prompt, it'll give you a few prompts in return, and then you write your own paper that way. Okay. I still say that's probably making your brain a little lazier, but it's saving time to go do something else, hopefully productive. Who knows with high school students?
Yeah. So I'm going to take a quick tangent back to compassion now, because it's something that I know that I guess not only in healthcare, but I guess maybe broader society as a whole. And it's something I started to think about when, I don't know if you're familiar with this online to BetterHelp. It's I think a app where people can get professional mental health care or something. And then I started thinking about that from a business standpoint. A company could be created that offers mental health care to, I guess, patients, but not real practitioners. Maybe an AI tool that can give you mental health care, I guess. Do you think that type of thing is ethical, in the sense that, because if we simplify maybe therapy to talk therapy, where someone sits down with you, hears what you're saying, and leads you to and ask you questions that give you clarity and maybe lead you to some type of mental state. I guess to some degree, an AI can do that, But but I guess by and large, if you zoom out, do you think it might be ethical to use those type of tools? Or because I know maybe in some ways they might be necessary, but do you think they might harm someone who has mental health issues, I guess?
Yeah, it's a very good question. So try and answer each part of that. So sometimes it does come down to a benefits outweighing risks scenario. I guess if we don't have enough healthcare providers, if you want to take the OpenAI viewpoint, something might be better than nothing. But then you have to figure out, well, how reliable is this? How accurate is this tool that's being used? Is it suffering the same problems as the other LLMs? Hallucinations and misinformation, etc. And then you have to think. So if it does give regardless of what it spits out, whether it be accurate or especially hallucinations or misinformation, how harmful will that be? So when you get into the psychotherapy, there's certainly a range of patient severity. You might have someone who's just a little anxious, but you might have someone who is potentially suicidal. And if you say the wrong thing, as an algorithm, I assume we're talking about a future scenario where there is no human in the loop, aside from just the patient. Yeah. So then if there's no doctor, then of course talking about liability falling to the healthcare system or the software company, but because you're probably not going to be able to sue the AI directly, even though there is some thought that AI might actually have more of a corporate status when it comes to like a corporate legal status, that of a corporation. But that's in the future. So how harmful would it be if this algorithm says something that ends up harming the patient? If it's only going to make the slightly anxious person, maybe a little more anxious because the right thing wasn't said, versus the suicidal patient who ends their life. Then you do run into much higher stakes, and that's where the ethics really get called into question. So much more severe outcome for using this algorithm, and maybe a human psychologist who could connect more would have been superior. I hope I outlined a couple of the ethical problems.
While you were talking, I think another thought that came to me was, if you actually think about compassion, there might be different ways, I guess, to be compassionate to different people. And it seems to me that something that I might say as a way to show compassion to someone might be a trigger to that person. And, and I guess for humans, like a human being can read the room and, kind of tune their sarcasm or the way they would talk based on the person that, is interacting with them. But I guess for an AI algorithm, it might be trained to be very general and maybe not too personalized. And so something that I might say, something the AI algorithm might say to show compassion might be something that triggers the anxious person, makes them more anxious or something. Yeah.
That's a fair point. You keep it really general. Well, and that actually, we'll talk about compassion. We'll dive into that a little bit. one final point I was thinking actually is if there's a disclaimer attached to this AI that is made clear to the patient that this is, essentially a watermark. I mean, like, hey, this is an AI, this isn't a human. So just you get what you get. Just so that the patient is not fooled in any way into thinking that the being on the other end of this interaction actually cares. So I think if that disclaimer is there, then I think it would be ethical enough. That would certainly help. And if it's a crappy tool, it's also kind of unethical to use it. But if the tool is good enough and there's a disclaimer that is clear enough, then it's a use at your own risk type of situation.
Yeah. So something that I talk about now is, in the case of HIPAA, where I guess the patient owns their record, right? And maybe if you wanted to make something very personal, I guess, just like personalized medicine, you want to make some type of AI that is personalized to the patient, and then this software takes all the patient medical data and builds a health profile about them. I don't know, do you think that that's something that might be against the law in some ways, where a software company can take all of the patient's data, history, and medical records and build some type of profile for them that the AI can use to personalize their medical journey going forward, I guess?
Yeah, it's a very good thought. Thinking like a software engineer, I'd say. As far as HIPAA, I think that a lot of people in both medicine and law regard HIPAA as severely outdated now. And I think a lot of that is because there's just so much patient data that is made available to any software companies that are trying to do just that, use that data to create some programs that can help patients. We have a lot more sophisticated encryption tools now for patient data. So you mentioned that the patient owns their data. I guess, I mean, it's definitely supposed to be protected, and we can protect it now, but HIPAA it needs to be updated to keep up with the current technology. And do any of us really own our data at all? So yeah, you could definitely take a lot of patient data and hopefully use it for good to try and help them to make personalized medical care. But then that gets into the part about compassion that you had brought up. You could say compassion of what kind? I mean, with no actual human provider there, then the only kind of compassion you're going to get is the healthcare network, the company, software company, whatever, the employees there that are working hard to try and make a product that is a usable tool that can interact with you and get you what you need. That's the most compassion you're going to get. But, of course, it's also imbued with a lot of people working really hard just because they love the job, because they want to make money. And I think a lot of fantastic new technologies and innovations have come around by people who just love their job and are looking to make money, but also by a lot of people that have the mission in mind that they want to do good for others. But I don't know if that's going to save someone who's suicidal in the heat of the moment.
Yeah, definitely. We're going to wrap up here pretty soon, but I guess something that I've been, I guess, curious to ask is, I think earlier this year, I was on a voice type of conversation with ChatGPT, and it seemed very natural. It just seemed like I was on a conversation with my friend, and I've used this tool for even brainstorming. Just say I want to do a task, and I just chit chat with this tool back and forth for brainstorming. And I guess this is something that could be that I guess people are using right now for maybe other things, because I know that, quote unquote, there's some type of loneliness epidemic that exists in some ways that kind of affects, I guess, mental health or whatever. But do you think that um do you think that this is, you know, a fair replacement for human interaction? Because some societies, I guess, are built by default for interaction, for communication, and some other societies are just the way they are, the way they are designed. They're not necessarily fine tuned for that interaction, communication, and in broad sense. Would you say that I don't is, I guess, good or bad that these type of tools exist to help certain people who happen to be in certain type of societies who that are not fine tuned for human interaction to the maximum or something?
Yes, very very good point. It seems that this technology, the LLMs, or just sophisticated machines in general, are more reactionary. They are built in order to fulfill a need, a gap somewhere, and I don't think it would be an equal replacement for human interaction in any way. But what it does do is, if you're Japan and you've got a limited workforce, investing in AI technological development is a necessity, and it can supplement the lack of workforce you have. If you have a situation in some developed country, US, for example, where you have a lot of people who are spread out from their families, they're lonely, and they're looking for something. And again, perhaps something is better than nothing.
Yeah.
But I guess maybe we could, if I could turn the question back to you, do you think do you think ChatGPT is an adequate replacement for sitting down with like a friend, or even just having a conversation with a friend overseas? Could a machine replace a human who on the other line who is at least capable of caring about you?
I would say, no, first of all, because, I think I've had really large and very meaningful and deep human connections with other people. And I think to a very large degree, I kind of know what like human friendship or human connection or human listening or showing compassion might mean. But I guess, maybe because of that knowledge, then, if I take something like ChatGPT, then it feels as though this is just another piece of software, But I guess, some other people might not have experienced certain things, so it would feel as though this is real for them, because I would say to a certain degree, I guess you only know to the degree to which you're aware. Maybe you can only know certain things to the degree to which you're aware. If maybe certain people have never really had, a friend that they can talk to, that they can laugh with, and they can connect to, have some type of conversations that are beyond just the day-to-day high level. How's the weather? you know, you know. So I guess for them, they might see it as really deep and true, I guess.
There is the capacity for that depth with human interaction that may never be possible with a human machine interaction, because the machine is never going to care.
Yeah. And I think a lot of companies like OpenAI are also restricting their models to behave like actual machines. And it's like if you want to get really personal with the model doesn't tells you that it's a software and it doesn't have opinions and thoughts and all. So I guess maybe that's a ethical thing on their side. I was like stopping AI models to like limit the type of things that AI models could say or do, and like making sure that they don't have thoughts and opinions, and or I guess fake thoughts and opinions like they're human beings. Yeah,
a lot of fine tuning still needed, for sure.
Yeah, sometimes you ask maybe these tools like a very personal question, and then they just tell you that they are not capable of doing that. I know. Yeah.
I think that's a step in the right direction. Manage expectations appropriately and be as part of transparency, right? Which is a key fundamental necessity of AI development. If you're dealing with an AI, humans deserve to know, because then you know what you're getting.
Yeah. So real quick, before I ask you, I guess my final question, I don't know if there's anything you want to say for 1 minute without any interruption, or
I really enjoyed this time. I think you're a wonderful person, great to talk to. I wish we could talk all day and all night, Kelvin, but I just want to thank you very much for having me on your podcast.
Yeah. So I usually ask almost everybody that comes on my show what the meaning of life is. So please tell me what the meaning of life is.
That is a wonderful question to ask someone, especially asking multiple people, because you can probably get an average answer. But I was once... Okay, so my own personal opinion is there is none. We are here, and life is what we make of it. And I'm sure I'm going to get lots of hate mail for saying that. But there's a whole deep-rooted reasons why I believe that. But I just feel like it's the only thing that seems consistently to make sense with a lot of the stories that you hear from all the patients coming in of all walks of life. Everyone's here just doing the best they can, trying to get by. But I would say that I was once taught that we are here as an opportunity to do good for others, to learn and to grow. And if you look at life in a positive way, it is exactly that. It's an opportunity, and it's something that none of us should waste.
Yeah. Something that really stuck out to me just now as you were giving that reply is, I guess as a medical practitioner, you've seen people in all walks of life, sad, depressed, happy, I guess, families that, caring for a loved one, and, the loved one is going through something, those type of things. Do you think, because, in the military, there's this, I guess, propaganda that they want to have some type of robotic, give military personnel some type of medication that makes them act unbothered about the mission that they go to. So they don't have any personal opinions. They just execute what they're supposed to execute on. So do you think there's that bit in maybe like a medical doctor? Because I would assume that a healthcare professional goes through a lot of those things as well, as like seeing different things, and so they, maybe there's that version of that, just the way you would want to tune a military man to not have opinions about any kind of mission that he's going to, good or bad. I don't know if there's that bit in a medical doctor or a healthcare professional.
Yeah, no, my first reaction to that is thinking about the technical difficulties there with everyone. Medications working differently on everybody. I mean, how far are you going to have to crank up the dose on this 300-pound guy versus and is there just going to be some people completely resistant to this medication, in which case they're the person who has come out of the cave and has seen the sun and tries to go back to the cave and tell everyone what the sun is, and nobody will understand. We don't want just I think nowadays we don't want simple automatons as even the lowest level of soldier. I think you want someone who respects the chain of command, but also, hey, thinks critically, and your thoughts about the mission probably matter for how you're going to conduct yourself, and how you will behave on the battlefield. And if you, well, let's say there are some medications that can have the perhaps, I guess, semi-intended consequence of complete mood stabilization to the point where you lack caring at all. A lot of antipsychotics might have this effect. Sometimes the antidepressant, anti-anxiety medicines, but typically you're not going to find that there's much that there are a whole lot of people that experience that effect where they just don't care about anything. And then if you give a medication, I mean, they do a lot of stuff to the military can definitely treat their soldiers differently than civilians. They don't bother counseling as much on vaccines and what have you. They just go and shoot you up and then send you on your way. So, autonomy of the private, sergeant, whatever, is not exactly the same as it would be as a civilian. But I feel like the overall flagrant violation of autonomy to where you would receive a medicine that would take away your emotional state, which is, well, as we might have concluded in the conversation, one of the last things that makes us human, and perhaps makes life worth living. I can't foresee that ever being allowed, and I think that takes away the compassion that we're talking about, and we've seen how important that is. So I don't know. I like that tangent, but I guess I'm not fully a believer yet that would ever happen.
Yeah, really, really nice. Yeah, it was really a pleasure talking with you, and I think this was a really great and helpful conversation for, I guess it'll be helpful for a lot of people to listen to this as well. Yeah, it was so nice talking with you. I appreciate your time, and I'm gonna link some of your details, like your website and some other things, in the description if people want to find that and contact you.
Thank you so much, Kelvin. I really do appreciate it. A pleasure.
Yeah. Pleasure is mine as well.
Okay, well, good luck with your studies. I can't wait until PhD, and I'll hopefully read one of your papers.
Yeah, thanks.
Take care, bud.
And that's it from me this week. I hope you enjoyed the podcast. Please leave a 5-star review on whatever platform you're listening from. Follow, like, subscribe, and do all that. If you have any questions, comments, or concerns, please reach out to me on Instagram or Twitter at Hinted Neuron. I hope you tune in again next time, and until then, stay curious.